Hello, this is Alfons Roeks in Adelaide, South Australia, with a general introduction to the evidence-informed e-videos. Adelaide, South Australia, and there are a few pictures here. You see where it's located on this massive island. This is Adelaide. A beautiful place. You see on the picture a couple of pictures of the beach, Canal Beach, Mount Lofty here, a couple of the beaches, the sunset, the wine region. In other words, Adelaide has a lot to offer apart from producing videos about obstetrics and gynecology, so don't worry about that. And you see beautifully how Mother Nature looks after its offspring in a very particular way. But I'm not talking about kangaroos, I'm not talking about koalas. Today I want to focus on a few things about these videos. Of course, it's primarily for English-speaking medical students. I'm really sorry that other languages are not yet included, but who knows, that's something for the future. Secondary, these videos are for junior doctors who commence to work in obstetrics and gynecology, or are sometimes working in emergency departments where they see women presenting with symptoms of complications of early pregnancy, or general practitioners in training. So I focus here on the students, the senior students and the junior doctors. The philosophy is no barriers, so it's free of charge, no password is required, open access, 24 hours per day, 7 days per week, whenever you feel interested. What is the vision? It's C to the power 3. First, I would hope that these videos can contribute to more competent, pleasantly confident and not arrogant, and caring, always caring medical students and doctors. These 3 C's are essential for a successful and satisfactory career. Short term, important for the students, being more confident to pass your exams. Long term, better personalized, individualized care for the woman. More reliable, you can more rely on your unique set of clinical skills that remains important in addition to all the diagnostic tests we have nowadays. More appropriate diagnosis and treatment the first time around, no duplication, that means more competent doctors. Fewer oversight, fewer complications and miscommunications, that results in more competent doctors. And most importantly as well, more satisfaction for both the caregivers and the caretakers, the receivers of our care. And that is of course the long-term driver of enjoying your job. The obvious warning: this is not a clinical practice guideline. Please always consider, it is a motherhood statement, but the special clinical background and the personal circumstances of your patient. Even if a randomized clinical trial shows that A is maybe the preferred treatment, sometimes you have to deviate from that if you have valid clinical considerations. Take your local guidelines into consideration because they're specific to your circumstances, where you work in Australia or abroad, rural or country, or in suburbia. Check with a more experienced clinician before you decide what the most appropriate care is for a particular woman and her baby, in case of doubt. Always check, because by checking, both you and the more experienced clinician will learn. Well, I'm not particularly fond of defensive medicine with more and more rules, because we are afraid for certain legal action maybe in the future. I'm somewhat glad that I've made these points crystal clear now. If you find some errors or oversights, please share that with me on the Daroga Adelaide, so Daroga, ADEL, @gmail.com email address. And of course, if you're happy and satisfied with the videos, feel free to share it with friends wherever they are. Happy learning, Alfons Roeks. Thank you.